Okay. Last class we discussed about agada tantra, introduction of agada tantra. Here major FAQs are Visha, Visha Vegas, Visha classification, important agadas. Then come to the modern toxicology and as well as forensic medicine in detail. So mainly they will ask about IPC sections, CRPC sections, detail about thanatology, death, study of death in all aspects, dactylography, podogram, okay, rigor mortis, algar mortis. So all related to the death, hanging, drowning, so prostrate, all important uh, topics of modern. So these are important FAQs. So usually you can ask one question, means definitely they will ask one question from IPC sections, one question from Vishavega and Vishavega Chikitsa, 100% question we will get, and then Visha classification. Okay. So these are all the major FAQs in Agada Tantra. Okay, Visha classification, Vishavega and Vishavega Chikitsa, IPC, CRPC sections. And next line question will be Visha Shodhana, fatal dose and fatal period. So what is the maximum dose of the Visha that will going to kill the person? In how many days? In how many hours you will going to die? So along with antidote. Okay, important antidote, universal antidote. What is antidote for so and so poison? Okay, these are all the major FAQs in Agada Tantra. Okay, so we'll just go through the previous year questions once. Then you will get some idea how the questions will come in Agada Tantra. This is our regular routine. In every subject, we will go with the question paper first. Then you will get some idea. It's called as reverse study. So first you will study the notes on topics. Then we will go to the question paper. So at that time you will miss something. First we will go through the question paper. We can go through the questions, how difficult questions they may come, in which areas they are given most importance. Uh, then we will come to the topics. That's better. Jalasantrasa is first described by. Jalasantrasa is first described by. Jalasantrasa means hydrophobia. Jalasantrasa is hydrophobia, where you will get the hydrophobia lakshanas in case of dog bite. So rabies infection. Okay. So rabies is usually spread through the dogs, infected dogs, or else infected rodents. It may be cat, it may be some other rodents. Okay. So this rabies will spread to the human being. So these lakshanas already documented in Sushu Samhita, so 2000 years back only. So it is first explained in Sushu Samhita. Okay. So you can note down the question also. Jalasantra was first described by Acharya Sushruta. Next question. You can also answer in chat box, those who are in the online. So ghee with honey is an example of. Ghee with an honey is an example of. Honey with ghee is an example of. ಗುಣ ವಿರುದ್ಧ, ಸಂಸ್ಕಾರ ವಿರುದ್ಧ, ಸಂಯೋಗ ವಿರುದ್ಧ, ಮಾತ್ರ ವಿರುದ್ಧ. Cough. Cough. Ghee with honey is an example of. ಮಾತ್ರ ವಿರುದ್ಧ, ಗುಣ ವಿರುದ್ಧ, ಸಂಸ್ಕಾರ ವಿರುದ್ಧ, ಸಂಯೋಗ ವಿರುದ್ಧ. So you know about honey and gruta. If you make equal quantity, definitely it will act as a poison. It is equal quantity. It's not samskara, matra. If you use honey and ghee equal matra, then it will become viruddha. It is matra viruddha, equal quantity of honey and ghee. But in one area in Charaka Samhita, so they used both honey and ghee in equal quantity. but still it is not a Viruddhahara. In which area? And Acharya Chakrapani also given the commentary on it. Though it is used as a equal quantity, it will not act as a poison. Our reference only, those who are already attended Charaka Chikitsa, you might have know about it. Charaka Samhita, Rasayana Adhyaya, Shavaнаprasha Rasayana, Shavaнаprasha Lekhya. So which is called as Bhargava Prokta Rasayana? Yes, Shavaнаprasha first chapter Tanuja correct. So Shavaнаprasha is called as Bhargava Prokta Rasayana. Okay. So in Bhargava Prokta Rasayana, in the preparation of Shavaнаprasha, Acharya Charaka told the equal quantity of honey and ghee usage, but still it will not act as a poison. Why it will not act as a poison? With other drugs, honey and ghee will not act as a poison if we use an equal quantity of it all. Okay. In Chavaнаprasha, we have a lot of other ingredients. If honey and ghee used with other ingredients, then it will not act as a poison. Though it is a Matra Viruddha, but with other ingredients, it won't act as a Viruddha. So this is the explanation given by Acharya Chakrapani in the context of Chavaнаprasha. It is also called as Bhargava Prokta Rasayana. Uttam Bhargava Prokta. So in the shloka only they are given. So Chavaнаprasha is also known as Bhargava Prokta Rasayana. So SDM company, they are branded in the same name. Chavaнаprasha is not different and Bhargava Prokta Rasayana is not different. Both are same. Chavaнаprasha is also known as Bhargava Prokta Rasayana. Then question comes, even you are using honey and ghee equal quantity in Swarnaprashana, regularly we are doing it every month. So there also it won't act as a poison because we are using honey and gruta with other ingredient, with the gold we are using, with other kashayas we are using, with other gruta we are using. Okay, so with vacha we are using, vacha and brahmi we are using in Swarna Prashana. So though we can use it as an equal quantity, but it won't act as a poison. Got it? Right. So this you must know about it. Gruta and honey equal quantity is Matra Viruddha. In equal matra only it will act as a poison, otherwise it won't act as a poison. The drug destroys the buddhi by virtue of its tamo guna is. The drug destroys the buddhi by virtue of its tamo guna is. The drug destroys the buddhi by virtue of its tamo guna is. Buddhi yadlumpate dravyam. Buddhi yadlumpate dravyam. The drug destroys the buddhi by virtue of its tamoguna is. Buddhi yadlumpate dravyam. Buddhi yadlumpate dravyam. ಯಾವುದು? ಶರಂಗದರ ರೆಫರೆನ್ಸ್. ಬುದ್ಧಿ ಯದ್ಲುಂಪತೆ ದ್ರವ್ಯಂ. ರೆಫರೆನ್ಸ್ ಇಸ್ ಶಾರಂಗದರ. ಯಾವುದಕ್ಕೆ? ವಿಚ್ ಡ್ರಗ್? ಹತ್ರ ಬಂದ್ಬಿಡಿ ಸೌಂಡ್. ಮದಕಾರಿ. ಬುದ್ಧಿ ಯದ್ಲುಂಪತೆ ದ್ರವ್ಯಂ ಈಸ್ ಮದಕಾರಿ. It's madakari. Buddhi yadlumpate dravyam is madakari. This is a classical reference given by Sharangadara. Kita Visha is dash predominant. Kita Visha is dash predominant. Kita Visha is dash predominant. Vata, Pitta, Vata Kapha, Vata Pitta. Kita Visha is dash predominant. Vata, Pitta, Vata Kapha, Vata Pitta. Yes, Vata Kapha. Kita Visha is dominant of Vata Kapha dosha. Shushka Shofa is the future seen due to the intake of dash. Shushka Shofa. Shushka Shofa is the future seen due to the intake of dash. Shushka Shofa. Shushka Shofa is the future seen due to the intake of dash. Mula Visha, Patra Visha, Phala Visha, Pushpa Visha. Mula, Patra, Phala, Pushpa. Mula, Patra, Phala, Pushpa. Shushka Shofa. Yenantandra, some questions we should not take risk. If you know the answer, then only we should go with it. No guessing. So if you guess, you will lose 1 mark. Okay, that is a huge loss. So up to 200 and 300 ranks will be there in single mark. So this year, more than 200, those who have a score more than 200, 200 to 240 within 2000 to 3000. Above 240, their rank will be within 1000. 240 to 480, only 1000 members. 240 rank number 2, 480, only 1000. 200 marks, only 1000. 200 to 240, 2000. 150 to 200, 8000. Almost. So that is the level of competition. If you are losing a single mark also, you will lose your 300 rank, 300 to 500 rank with single rank question. Okay. So answer is Phalavisha. Anupana told for Dushi Vishari Agada is. Anupana told for Dushi Vishari Agada. Anupana told for Dushi Vishari Agada. Madhu, Gruta, Madhu and Gruta, Jala. Madhu, Gruta, Madhu and Gruta and Jala. Anupana told for Dushi Vishari Agada. Madhu, Gruta, Madhu and Gruta and Jala. What is the Anupana for Dushi Vishari Agada? Agada, main ingredient of the Agada, indication of the particular Agada, and then Anupana. All this information you must know. So here the Anupana for Dushi Vishari Agada is Madhu. Almost all Agadas, Madhu and Gruta will be the universal Anupana. Okay. When come to Visha, even Kshira, Madhu and Gruta will be the natural antipoison properties. So all Panchagavya Gruta, Gomutra, Gogruta, Gokshira having antipoisonous activity. Okay. Even Gruta will act as a demissellent in case of corrosive poison, in case of acidic poison. Okay. It won't make the poison to absorb. Okay. So that is the action of Gruta. Here in Dushi Visharyagada, the Anupana is Madhu. Okay. Sarpadamstra Prakaras according to Ashtanga Hridaya are. Sarpadamstra Prakaras according to Ashtanga Hridaya are? Option 3, 4, 5, 6. Sarpadamstra Prakaras according to Ashtanga Hridaya are. ಸೊ ಅಂದ್ರೆ ಸ್ನೇಕ್ ಬೈಟ್ ಮಾಡತ್ತಲ್ಲ, ಸ್ನೇಕ್ ಬೈಟ್ ಅಲ್ಲಿ ದೇ ಆರ್ ಮೇಕಿಂಗ್ ಎ ಡಿಫರೆನ್ಸಸ್. ಹೌ ಇಟ್ ವಿಲ್ ಬೈಟ್? 2 flanks, 3 flanks, with bleeding, without bleeding, ಸೊ ವಿತ್ ಮಸಲ್ ಕಮ್ ಔಟ್. ಸೊ ಅದಕ್ಕೆ ಡಿಫ್ರೆಂಟ್ ನೇಮ್ಸ್, ತುಂಡಹತ, ವ್ಯಾಲಿಡ, ವ್ಯಾಲುಪ್ತ, ಓಕೆ, ದುಷ್ಟಕ, ದಂಷ್ಟ್ರ ನಿಪೀಡಿತ. ಸೊ ದಿಸ್ ಆರ್ ಆಲ್ ದ 5 varieties told by Acharya Vagbata in Ashtanga Hridaya. There are 5. Okay. So 3, 4, 5, 6. Answer is 5. Tundata, Valida, Valupta, Damstaka, Damstra Nipidita. There are 5. Next question. As per Sushruta, Mandali Visha is considered to be the most potent in its age. Which age? According to Sushruta, Mandali Visha is considered to be the most potent in its dash age. So usually nowadays, last 5 years, AAPGD, so there will be no confusion in the questions. So previously with AAPGT, Jamnagar and everywhere, there will be a lot of confusions with the questions. Simply they will take, accordingly they won't ask. Simply they will take. At that time, if the questions come from agada tantra, we should go with the reference of Sushruta. If the questions come from Kaya Chikitsa, we should go with the authenticity of Charaka. If the questions come with Sharir Rachana and Kriya, we should go with the authenticity of Sushruta. Okay. So Shalakya again Sushruta, Shalya again Sushruta. So like that we are depending on some authors for some subjects. Nowadays, no issues like that. From the beginning of the question only, they will start with this is according to Sharangadhara, according to Sushruta, according to Ashtanga Sangara, according to Ashtanga Hridaya. Even they will not, they won't take according to Vagbata. Nowadays, they are more specific. According to Ashtanga Hridaya, so and so chapter. So, what is the answer for this? Like that. Sharangadhara Samhita, Vajraratnavali. So directly they will take the reference. Nowadays, no issue with the reference and no ambiguity questions, no confusions in the questions. It's very clear. So, as per Sushruta, Mandali Visha is considered to be the most potent in its dash age. Tarunavastha, Ruddhavastha, Madhyamavastha, no such concept explained in Sushruta. In which age the Mandali Visha is considered to be the most potent? Ruddhavastha, DMR. In Visha Chikitsa, the dose of Anjana to be used as per Sushruta. The dose of Anjana to be used as per Sushruta. What is the Anjana dose according to Sushruta? Dose of Anjana. So, 1 Rati, 1 Masha, 2 Masha, 1 Yava. Dose of Anjana. In one area in folklore practice, they will put some swarasa to the eye, and there is a continuous lacrimination from that eye. So the snake poison will rectified. It will nullified. Patient will be alive. After a strong poisonous snake bite also. So their concept and the password is, if the snake bite will happen in the right side of the body, they will put swarasa to the left eye. If the snake bite happen in the left part of the body, they will put swarasa to the right eye. Their concept is very clear. So right part of the brain will be controlling the left part of the body, and left part of the brain will control the right part of the body. Okay, and snake poison is a neurotoxic. Once it reaches the brain, then patient death starts. So that's why in chikitsa of Visha chikitsa, first and foremost line of treatment is mantra. Then they will start with Arishta Bandhana. We need to stop the circulation. First one is mantra, second is Arishta Bandhana. So we need to put the tie over there. We need to tie that one. We need to slow down the circulation. Try to take out as much of Visha possible from that place. We need to make a big wound and let the blood will ooze out. It should not enter in, but the blood should ooze out so that the poison will come out. Even if you are in a forest, even if you are in some other place, sudden bite happens. What you have to do is do the Arishta Bandhana and take out the maximum blood from that place so that you should not reaches the bloodstream and you should not reach the brain. That is the first aid. In some places they will use chicken also. So uh, the bottom of the chicken will be kept over the bite area. Okay, so that will suck the blood, that will suck the poison from the particular place. Okay, the anal region of chicken will be make a wound and it will be kept over the area. It's in a folklore practice. Still, they are following it. Some areas they will use some stone, anti-poisonous stones. They will keep anti-poisonous stones over the poisoned area, the bitten area, and immediately they will keep the stone over the water. Then all water becomes a blue. You can see that. Even in olden days, we have seen a lot of miracles like this. Nowadays, it's not possible. The stone they won't reveal which stone they will use, but definitely the stone has a capacity to suck the poison from the body. It's an osmosis effect, so poison will move from the body to the stone. Okay, somewhere they will use some other gemstones also. Somewhere they are using a mantra also. Okay, for a snake bite. So in this place they are using a swarasa. So nearby Tumkur. So I also visited the place. I asked him which swarasa I will use. They won't reveal. So because it's their folklore practice, it's come from their ancient, their grandma, grandfather. So from their generations, they won't reveal. I told my identity. I'm a doctor practicing nearby. So if you tell I can help you, some other people to know these things. First, second day they won't reveal. Continuously, I used to go. Finally, he told at fifth day. So it's just a betel leaf. Betel leaf swarasa. Nagavalli swarasa. The name Nagavalli came from it is a antidote for snake poison. But the usage is we need to put it to the eyes. The name Nagavalli, it's given, it will climb like a snake over other pillar, any pillar like thing, or it may be a tree, it will climb like a snake. That's why it's called as Nagavalli. Usually it will be attached to the aracanut or else coconut. Okay, some other silver oak trees, they will plant Nagavalli, betel leaf, this one plant. But the name, actual name Nagavalli means it is an antidote for the snake poison. The thing is, password here is it should be used opposite side. They know this is a neurotoxic. Snake poison is a neurotoxic. This toxin should be removed from the eyes before reaching the brain. If it is reached the brain also, we should remove through the eyes. So whole day you will get a secretion. Whole day, not a single day. 3 hours, 4 hours, continuous lacrimation. Used to put that swarasa oftenly, every 30 minutes. Continuously will put the swarasa, continuously it will come out. Whole eye becomes red. You will have a burning sensation. Still, it will come down. So it will be good, quite okay. After some 2 to 3 hours, there will be no toxic signs. He will be go to the home. And one more thing, so during a poison bites, so you should not sleep over the night, the same night. Thing is, there is a less cardiac activity during sleep. So especially in case of scorpion stinge. In case of scorpion stinge, because scorpion poison is a cardiotoxic. So if he sleeps means he may have a fatality. So the cardiac arrest chances may be higher. So that's why in any case of poisons, so our ancestors won't allow them to sleep in the night. For that reason, they will keep some other bhajana, other things, sobana pada, something they will keep and they will watch him to be awake over the night. Okay, you might have seen these things in many Mahabharata, Ramayana, Chanakya. So many areas will get the reference of this, but it is very true. So this is a plant Nagavalli Swarasa. They use it for snake poison. Okay, so wherever you can, if you are a trucker or if you are going in a forest, just keep bitter leaf in your pocket. It will save you from emergency. So what is the treatment for snake poison? Anti-snake venom. Anti-snake venom injection only they will give you in modern. So not a single one. They will give 10, 20, 30, 40, 100, even more than 100 also anti-snake venom injection they will give till the patient will out of danger. Till then they will continuously advise anti-snake venom injections. Okay, if it is an emergency within 45 minutes to 1 hour, if it is a snake with having a highest poison, the patient will die within 45 minutes to 1.5 hour. King cobra like thing. Okay, so I have seen many people they will catch the snake catchers. They will die with a snake poison. Okay, so they have so much of experience, 20 years, 30 years. So avoiding paper, so many of them die because snake poison, bite of the snake. So in that case also in emergency we can use this Nagavali Swarasa. We should keep it right high. Right part ಅಲ್ಲಿ bite ಆಗಿದ್ರೆ left side ಅಲ್ಲಿ bite ಆಗಿದ್ರೆ right side. So like that one more drug with the same experience I've used for jaundice. Okay, whatever may be the infection, it may be viral infection or it may be any other liver toxicity, liver cirrhosis. If the bilirubin count is there more than 5, we can use one drug for nausea. It's a dry drug, so we should soak the old drug for a overnight, and just you can keep some drops of drug uh, over the nostrils, two nostrils, directly. No need of abhyangas, vedana, classical thing. Just put some 8 to 10 drops of these drugs to the nostrils. We have tried it in hepatic encephalopathy, hepatic coma conditions because of liver failure. Patient was go to the coma. We need to wake him up by putting these drops to the nose. But this is only having a symptomatic relief. This will reduce the bilirubin load to the brain. This will reduce the bilirubin count from the blood. So just check it out. Just putting these drops over the nose, and before that you just check the bilirubin count. After 8 hours, you just check the bilirubin count. 8 to 10 bilirubin count will be reduced by just single day therapy. What is the drug? Any idea? G Mutaka, Lufa echinata. Botanical name is Lufa echinata. G Mutaka. G Mutaka. Note it down. G Mutaka, Lufa echinata. Some company made a Jandif nasal drops. Jandif in the name of Jandif nasal drop. Nowadays it is not available. So we can, dry drug is easily available in some dry form. In ಕನ್ನಡದಲ್ಲಿ ಕೂಡ ಅದು ಕಹಿ ಹೀರೆಕಾಯಿ ಅಂತ ಕರೀತಾರೆ, ಮುಳ್ಳು ಇರುತ್ತೆ ಅದರಲ್ಲಿ. In Kannada it's called as kahi hೀರೆಕಾಯಿ. It contains thorns ತರ ಇರುತ್ತೆ, small one ಇಷ್ಟೇ ಇರುತ್ತೆ. I will show you, it's there in my clinic. My study is alcoholic liver disease only. So I've collected all the materials required for the treatment. So hepatic coma, hepatic encephalopathies, we managed alcoholic liver disease. So I tried it for many patients. So after putting these nasal drops, till evening there will be continuous secretion from the nose. Continuous secretion, yellowish secretion. So we'll give one kidney tray to the patient, let him hold for evening. Till evening, more than 1 liter of secretion he will collect. Only pure yellow secretion. That is the power of Jimutaka. It is also a folklore product. We have learnt it from remote area from Maharashtra. These drugs, they are using it for jaundice. Their patient will go, they will put some drops to the nose, they will come back. Within 2 3 days, jaundice will be all right. Okay. So it's very good in case of IR bilirubin count. It having only symptomatic relief. There is no cure of jaundice and all. So if it is a viral jaundice, hepatitis A, definitely within 7 to 14 days, patient will be all right automatically. There is no requirement of medication. There is no any other interventions. Just by giving a rest, patient will be all right. In case of hepatitis A, okay, hepatitis B, chemical damage, other things, some medical intervention is needed. We need to select what type of infection it is, what type of damage happened to the liver. Then only we can decide the drugs. This Jimutaka having a very important role in reducing bilirubin count from the blood. Okay. Very important drug in folklore practice for jaundice is Bhumya Malaki. Everywhere they are using. It's a very good antiviral drug. So it can be used in all cases of hepatotoxicity. Okay, hepatocyte protective also. So this is very common drug used everywhere. So ಯಾವುದು ಭೂಮಿ ಅಮಲಕ್ಕಿ. Okay, and 1 gram of ಭೂಮಿ ಅಮಲಕ್ಕಿ dry drug extract will be available in the brand name Nirosil. Nirosil. It's a brand name. Solanki's company, a sister company of Dut Tapeshwar, Solanki's. They will made 1 gram of ಭೂಮಿ ಅಮಲಕ್ಕಿ, 1 gram extract. Sun tablet or the 1 gram extract together. You can use single drug. You can use it in case of hepatic jaundice anywhere. And one more easily available drug. You cannot imagine that this drug will work on jaundice. Very easily available drug. It's an antipoisonous activity is also there. Any guesses? Easily available. Bangalore, it is present everywhere. Every empty space it will grow in Bangalore. We are using it in Amwata also. This drug can be used in jaundice, inflammation. Erenda. Erenda patra. Not Erenda Mula, Erenda Taila, or any other part of Erenda. It is a Erenda Patra. So Erenda Patra is very strong hepatoprotective drug, and it will be very good in case of hepatitis, jaundice. It will reduce inflammation in the liver. Very fastly, it will reduce bilirubin count. Erenda Swarasa. So you make a combination of Erenda Swarasa, Bhumi Amalaki, Guduchi, and aloe vera, Kumariswaras, all four having a very good hepatoprotective activity in case of inflamed liver. So we can use, and in somewhere in folklore practice, they will ask the patient to bring one coconut water, tender coconut water. With the tender coconut water only, they will make this farasa. They won't put water. Okay, either single drug or with the combination. They will put Erenda Patra, so 3 4 Erenda Patra, small Erenda Patra they will put, 2 3 Guduchi leaves, and some pulp of aloe vera and Bhumi Amalaki. Highest amount is Bhumi Amalaki they will use. They can make a swarasa of 100 ml and they will give it to the patient. In some area near Andhra Pradesh is one place, Walija. In any in folklore, in mouth-to-mouth communication, any person will having a jaundice, they will visit there. Walija, I think the place name is Walija. There they will give you the medicine with butter, ಬೆಣ್ಣೆಲಿ ಇಟ್ಟು ಕೊಡ್ತಾರೆ. So you are visited the place, and the drug is nothing but bhumi amlaki, valija. Okay, so wet leaves to make a kalka of it, a strong kalka. So more than 6 hours they will triturate, make a strong kalka of it, and with butter they will keep it in the mouth, and they will leave the place, and they will tell up to 2 hours don't drink anything. Till 2 hours don't drink anything. They will advise only coconut water and sugarcane juice for another 3 days. No food, only coconut water and sugarcane juice to give rest to the liver. Why butter? My question is, why he selected only butter? They can use gruta or any other anupana. They can use. They use anupana as a butter. Here, rationality is any fat material enter into the body, it will reaches the liver. Okay, so fat emulsification will be done by bile juice. Drug tagging. Always we should think about anupanas are drug launchers, vehicles. Okay, so that will redirect the herb or drug to the particular organ. There they will use butter to reach the liver very fast, instant result. Okay, they will triturate with the butter, and they will give it to the patient. Some 20 ml, 30 ml, 60 ml. They will just check with a torch, eyes and other things. Immediately they will make this thing and they will give. So this is a folklore practice in case of jaundice. Okay, ಎಲ್ಲಿದ್ವಿ ನಾವು ಸ್ನೇಕ್ ಪಾಯ್ಸನ್ ಅಲ್ವಾ ಇದೆಲ್ಲ ಬಂದಿದ್ದು ಯಾವ್ದಪ್ಪ ಅಂಜನ
Dose of Anjana.
ಅಂಜನಾಗ್ ಬಂತಿದೆಲ್ಲ. So Visha Chikisa, the dose of Anjana to be used as per Sushruta. 1 Rati, 1 Masha, 2 Masha, 1 Yava. It is 1 Masha. ರೆಫರೆನ್ಸ್ ಇದೆ ಇದಕ್ಕೆ 1 ಮಾಶನೇ ಏನಕ್ಕೆ ಯೂಸ್ ಮಾಡಬೇಕು, ಎಷ್ಟು ಯೂಸ್ ಮಾಡಬೇಕು ಇದೆಲ್ಲ. According to Charaka Samhita, Avyukta Rasa leads to the following in Visha. Avyukta Rasa leads to the following in Visha. According to Charaka Samhita, Avyukta Rasa leads to following in Visha. Marana, Kapha Prakopa, Raktadushti, Murcha. Avyukta Rasa is the guna told by Charaka in Visha. There are Dasha gunas of Visha. Out of that, Avyukta Rasa is the one. Visha Rasa is Avyukta Rasa according to Charaka. So what Avyukta Rasa will do in Visha? Okay. So Marana, Kapha Prakopa, Raktadushti, and Murchana. What is your answer? Kapha Prakopa. Avyukta Rasa will do Kapha Prakopa. Gruhadhumavam Purishayam Yo Atisaryate. Gruhadhumavam Purishayam Yo Atisaryate is seen. Gruhadhumavam Purishayam Yo Atisaryate is seen. ಅಂದ್ರೆ ಗೃಹಧೂಮ ತರ ಪುರುಷ ಬರ್ತಾ ಇರುತ್ತೆ. ಸೊ ಅಂಡ್ ಅತಿಸಾರ ಇಸ್ ಸೀನ್ ಇನ್ ವಿಚ್ ವಿಷ ವೇಗ. The question is very clear. This question is related to Visha Vega. Okay. Sthavara Visha 4th Vega, Jangama Visha 6th Vega, Visha Pita Lakshana, and Gara Visha. Jangama Visha 6th Vega. Jangama Visha 6th Vega. Answer is Jangama Visha 6th Vega. Next question. Shiri Ruksha Twak Lepa is specifically indicated by Charaka far. Shiri Ruksha Twak Lepa is specifically indicated by Charaka far. Shiri Ruksha Twak Lepa is specifically indicated by Charaka far. Rajila Visha, Kanaba Visha, Rushchika Visha, Kita Visha. Rajila Visha, Kanaba Visha, Rushchika Visha, Kita Visha. Kshiri Rukshatva Klepa is specifically indicated by Charaka far. Rajila Visha, Kanaba Visha, Rushchika Visha, Kita Visha. ಯಾವುದಕ್ಕೆ ಕೀಟ ವಿಷ. ಸೊ ಅಗರತಂತ್ರದಲ್ಲಿ ನಿಮ್ಗೆ ವಿಲ್ ಗೆಟ್ ಲಾಟ್ ಆಫ್ ಕ್ವಶನ್ಸ್ ಅಂಡ್ ಲಾಟ್ ಆಫ್ ರೆಫರೆನ್ಸಸ್. ಸೊ ಓದಿದ್ರಷ್ಟೇ ಗೊತ್ತಾಗತ್ತೆ. ಯು ಹ್ಯಾವ್ ಟು ಗೋ ಇನ್ ಡೀಪ್ ವಿತ್ ದರ್ ಸೇಮ್ ರೆಫರೆನ್ಸಸ್. ಚರಕ ಚಿಕಿತ್ಸಾ 23rd ಚಾಪ್ಟರ್, ಸುಶ್ರುತ ಓಲ್ ಆಫ್ ಕಲ್ಪಸ್ಥಾನ, ಅಷ್ಟಾಂಗ ಸಂಗ್ರಹ 35th to 38th ಚಾಪ್ಟರ್, ಅಷ್ಟಾಂಗ ಹೃದಯ 40 to 48th ಚಾಪ್ಟರ್. So you go with all the references, then only you will understand. Okay, make notes from all these things, all these areas. Shonita Dushta Aruna Kitam Kotalingam Cha. Shonita Drushtam Arahu Kitam Kotalingam Cha refers to. Shonita Dushtam Arahu Kitam Kotalingam Cha refers to. ಇದು ಶೋಣಿತ ದೃಷ್ಟಿ ಆಗಿರುತ್ತೆ. ಅಂಡ್ ಕೀಟಂ ಕೋಟಲಿಂಗಂ, just like insect bite ತರ ಕೂಡ ಕೋಟ ಬರುತ್ತೆ. The pimples will appear like that of insect bite. This is refers to option A Garavisha, option B Viruddha Ahara, option C Dushi Visha, option D none. Garavisha, Viruddha Ahara, Dushi Visha none. Garavisha, Viruddha Ahara, Dushi Visha none. Garavisha, Viruddha Ahara, Dushi Visha none. Shonita Dushtam Arahum Kitam Kodalingam Cha Dushi Visha. This reference is from Dushi Visha. At least you should make some 50 shlokas from each subject. By end of the classes, you can able to tell at least some 1000 shlokas in Tanga Fatip, at least reference and important shlokas. Okay, make a practice of shlokas every day. Try to wake up by 5 o'clock. Not possible. According to Sushruta Samhita, Pancha Shirisha Agada is specifically indicated in. According to Sushruta Samhita, Pancha Shirisha Agada is specifically indicated in. If you want to achieve anything, the Brahmi Muhurta will support you well. So then we can ask, what is Brahmi Muhurta? The last prahara of the night is Brahma Muhurta. Muhurta is 48 minutes. It's not, we cannot take 48 minutes as a Brahma Muhurta or Brahmi Kala. Brahmi Kala is last prahara of the night. It means to say that last 3 hours of the night. So it means to say that you should wake up by 3 o'clock and we should study till 6:30. 3:30 to 6:30 is called as Brahma Kala. At least last 3 hours of the night. By that you should take sleep by 9 o'clock and you should wake up by 3. Read up to 7. Again, take sleep. So that is Brahmi Muhurta. So that is the Manana Kala, that what we can think. If you want to memorize anything, it will easily enter into your mind. There will be no environmental disturbances. and oxygen will be very high in the environment. Okay, and serotonin levels in the body is very high, and mind will be in the happy mood set, and freshness will be there. So it will all apply if you slept at 8:30 or 9. If you slept by 12 o'clock and if you wake up by 3, nothing will happen. You'll get more sleep after that. So take early bed and wake up early. During olden days, there is no electricity and other things. The people will lie, goes to the bed within 7:30. When the sunset happens by 6:30, so they will go to bed within 1 or 2 hours of the sunset. And they used to wake up by 4:30, maximum by 5. They start their routine work. Before sunrise, they have to reach to their places, their farms, reach at time. So olden days, agriculture is the main source of income and as well as main occupation. Almost 90% of the people will do agriculture. Okay. So for them, Brahmi Muhurta is very important. And even in Gurukulas, they used to wake up by Brahmi Muhurta and they have to take a dip in the river during midnight, during that time, during 3 o'clock. And they have to start reading by 4 a.m. at least. That was the tradition. Okay. So that is the best time for Manana Kala. And if you want to achieve anything, you should wake up by in Brahmi Muhurta. So if you want a APGT seat by 2023, that will be only in government college, you should wake up by 5 a.m. If you are ready, you will start doing classes by 5 to 7:30 only morning. We have tried it last year or before last year. Nobody was joined. You only wake up by 5 o'clock and you'll start the class, but nobody came. So our people mindset already changed. The thing is, the early morning reading, early morning uh, listening is very good. At least you wake up by early morning and listen to the classes, listen to the videos. Yes, yeah, two, three people raise their hand. We will wake up by 5 o'clock and we can take the class. We will do the trial. Don't worry. 1, 2, 3 classes trial ಮಾಡಿ ನೋಡೋಣ early morning. It's a Brahmi Kala, Brahmi Muhurta. Even my gurus, ನಮ್ದು moving charaka, Dr. Anjaney Murthy. Anjaney Murthy sir is there in Mysore, retired professor. And he used to visit their guru place by 3 o'clock for Charaka Patada. 3 to 6:30, they will read Charaka, and by 9 o'clock, they will reach college. That was their routine. They used to wake up by 2:30 and they will take bath, everything. Then they will go to his teacher house by 3. So at least we should wake up by 4. We should get ready by 5. Hmm. Agate, everything is possible. Beke bekadnaga, we have to do it. If really want it, definitely we will do it. Option A, according to Sushruta Samhita, Pancha Shirisha Jagada is specifically indicated in Kita Visha, Sarpa Visha, Luta Visha, Dushi Visha. Yes, we'll try 2, 3 classes. Answer is Luta Visha. Answer is Luta Visha. Drugs mentioned by Sushruta in the management of Alarka Visha. Drugs mentioned by Sushruta in the management of Alarka Visha. Datura, Shweta Pranama. Both A and B. Option D is Shirisha. Datura Mula, Shweta Pranama. Both A and B. And option D is Shirisha. What is the drug? Datura Mula. Alarka Visha. Dogbird personally, Acharya Sushruta used Datura Mula. Coma cocktail compromises the following ingredients except. Coma cocktail has following ingredients except. Coma cocktail. Coma cocktail comprise of following ingredients except. Option A, thiamine. Option B, 50% of glucose. Option C, naloxone. Option D, cyanocobalamin. Thiamine, 50% of glucose, naloxone, cyanocobalamin. Coma cocktail. So coma cocktail contains thiamine, naloxone, and 50% of glucose. It doesn't contain cyanocobalamin as one of the ingredient. Next question. Nowadays, the question paper has long questions. Question will not end in single line. So their intention is very clear. They want to waste your time. Question may be simple, but reading it will take time. So usually we will give you like 20 seconds or 30 seconds to finish one question. If question is long, you have to take at least 40 to 50 seconds to finish question for one round. Okay, so that is their intention, but still you have to cope up the time. Okay, so do faster, read fast and analyze fast, and make an option also very fast. So post-mortem findings in case of death due to suspected poisoning, showing post-mortem staining, bright red or cherry red with detectable smell is suggestive of dash poisoning. Question is 3 lines. Question is very simple. In post-mortem findings, in post-mortem staining, there is a bright red or cherry red in color with a detectable smell is suggestive of dash poisoning. The content of stomach. Okay. So usually urine. The staining will be there in it. So what type of poisoning it is? Option A, carbon monoxide. Option B, hydrogen cyanide. Option C, potassium cyanide. Option D, sodium cyanide. Carbon monoxide, hydrogen cyanide, potassium cyanide, sodium cyanide. So in postmortem, suspecting a poison showing postmortem staining of bright red or cherry red with a detectable smell. You notice there are cyanide killing in movies. So something they will wear in the necklace or in neckband. Immediately they will take. Okay. So within no time you will die. So that is cyanide death. Okay. So you have seen it in some Veerappan movies and other movies. So if police catches him before he will going to torture, he will going to die. In olden days, it's very common. We have seen in many movies. But why cyanide always will be kept in a glass container? So it will be always there with a small container, small glass tube. So you wear it in the necklace, in neckband. Thing is, if cyanide enter into the blood, then only it will act very faster. If he breaks that glass, immediately that glass will make a bleeding in the mouth. That cyanide will enter directly into the blood. Okay, so within 30 to 60 seconds, patient will die if cyanide enters directly into the blood. That's why always it should be kept in glass containers. In case of emergency, they want to suicide immediately, they will keep it in glass container. If you break it, immediately bleeding will start, the cyanide will enter into the blood. Here the answer is carbon monoxide. Carbon monoxide poisoning will have a bright red or cherry red with detectable smell is noted. In postmortem findings in suspected poisoning and internal findings when stomach contents looks like a luminous in dark, the poison is. In postmortem findings in suspected poison and internal findings when stomach contents looks like a luminous in dark, the poison is. The content of stomach is very bright. How much it's bright means in dark also it is shiny. In the darkness, luminous in bright means in the dark also it is shining. What may be the poison? Option A, cyanogen. Option B, formaldehyde. Option C, phosphorus. Option D, chlorinated hydrochloride. In postmortem findings in suspected poisoning and internal findings when stomach contents luminous in dark, the poison is cyanogen, formaldehyde, phosphorus, chlorinated hydrocarbon. Answer is phosphorus. Phosphorus is also known as phosphorus and mercury, also known as Diwali poison. Diwali poison, Deepavali poison, phosphorus. Next question. In the management of poisoning, Ipecac, IPECS, Ipecac syrup is contraindicated in following conditions except. In management of poisoning, Ipecac syrup is contraindicated. Ipecac syrup is contraindicated in following conditions except. Okay. In management of poisoning, Ipecac syrup is contraindicated in the following conditions except. Option A. Godaita, what is Ipecac andre? Question. I understand the question. Ipecac syrup is contraindicated in the following conditions except. Ipecac is a syrup given to induce vomiting in case of poisoning. Ipecac is a drug of choice as a syrup used to induce vomiting in case of poisoning. Okay. So the question is very clear. In the management of poisoning, this syrup is used. This syrup is contraindicated. This syrup is contraindicated in the following conditions. This syrup is contraindicated in the following conditions except. Another double negative one. The contraindication plus except. It means say it is indicated. You need to understand the question first. Options. Comatose patients are attenuated mental status. Patient is in coma. An attenuated mental status. Semi-coma mental status ಅಲ್ಲಿ vomiting induce ಮಾಡಕ್ಕಾಗತ್ತಾ? It's highly impossible. Otherwise, it will enter into the lungs. It may cause some other problem. No. Ingestion of petroleum or distillation or hydrocarbons. Ingestion of petroleum, distillation or hydrocarbons. Option B. Option C. Severe hypertension. In case of severe hypertension, whether we have to advise this one? No. Option D. In patients with a recent ingestions or involving substances poorly absorbed. So poorly absorbed ಇದೆ, recent ಇದೆ, and that time we can induce vomiting. So ಇದರಲ್ಲಿ 4 options ಅಲ್ಲಿ in which case we can advise Ipecac ಅನ್ನೋದು is our task. First one is comatose or ill mental status. In that patients we cannot give. Second is ingestion of petroleum or distillation or hydrocarbons. Ingestion of petroleum products, it may be kerosene, it may be diesel, it may be petrol. Okay, so in olden days we used to use the kerosene for lighting a lamps. During summer in North Karnataka, so usually the kids will going to drink this kerosene. They thought it is a water. Mistakenly also they may drink kerosene. So without analyzing whether it is a water or whether it is a kerosene. Like that we have seen many cases while working in Ballari. Okay. So hydrocarbons usually no requirement of any medications in case of hydrocarbon ingestion. It will evaporate through lungs. Any hydrocarbons It may be kerosene, petrol, or this one. It will operate through the lungs. We need to keep very good oxygen supply to the lungs and some broad spectrum antibiotics. So to stop any other infections during this, need to monitor the patient for 5 to 7 days. After that, we will send back the patient to the home. Not requirement of any other vomiting induction medicines during hydrocarbon poisoning. But it depends on how much quantity they drink. Again, it plays a vital role. If it is a recent ingestion, so let them vomit, or else very huge quantity or after 2 3 hours. So no vomiting should be induced in case of hydrocarbon poisoning. Okay, so it will settle by 2 to 3 months. So if you go to the patient place, patient bed, you will going to smell the petroleum product. It will operate through the lungs, through the respiration. ಸ್ಮೆಲ್ ಬರ್ತಾ ಇರುತ್ತೆ ಪೇಷಂಟ್ ಹತ್ರ ಹೋಗಿದ ತಕ್ಷಣ ಯು ವಿಲ್ ಗೋಯಿಂಗ್ ಟು ಸ್ಮೆಲ್ ದ ಪೆಟ್ರೋಲಿಯಂ ಪ್ರಾಡಕ್ಟ್ ಕೆರೋಸಿನ್ ಸ್ಮೆಲ್ ಅವ್ನು ಕುಡ್ದಿದ್ದಾರೆ ಇದು ಬರ್ತಾ ಇರುತ್ತೆ 2 3 days ಬರುತ್ತೆ ಆಮೇಲಿಂದ ಸ್ಟಾಪ್ ಆಗ್ಬಿಡುತ್ತೆ ದೆನ್ ಆಫ್ಟರ್ 2 days ವಿಲ್ ಸೆಂಡ್ ಬ್ಯಾಕ್ ದ ಪೇಷಂಟ್ ದ ಹೋಮ್ ದಟ್ ಇಸ್ ದ ಮ್ಯಾನೇಜ್ಮೆಂಟ್ ಇನ್ ಕೇಸ್ ಆಫ್ ಹೈಡ್ರೋಕಾರ್ಬನ್ ಪಾಯ್ಸನಿಂಗ್ ಓಕೆ ಸೊ ಈ ಕೇಸಲ್ಲಿ ಕೂಡ ನಾವು ಇಮಿಡಿಯೇಟ್ ಆಗಿ ಸಿರಪ್ ಕೊಟ್ಟೇನು ವಾಮಿಟಿಂಗ್ ಮಾಡಿಸಲ್ಲ ಸೊ ಥರ್ಡ್ ಈಸ್ ಸಿವಿಯರ್ ಹೈಪರ್ ಟೆನ್ಷನ್ ಸೊ ಹೈಪರ್ ಟೆನ್ಷನ್ ಇರೋ ಪೇಷಂಟ್ಗೆ ಓನ್ ಡು ಓಮನ any Rudroga or hypertension. So before Omana, we will take one ECG for safer side, and better we can take some physician opinion whether we can induce Omana or not. Omana is not a simple procedure to do for everybody. Okay, classical Omana. So all patient criteria we should look into, and he should not be obese. Okay, and he should not hesitate to vomit. One patient he doesn't vomit in their lifetime. He is very hesitate to do vomiting. In that patient, he is a psoriatic arthritis patient. Lot of patches in the head and in the upper body. We planned for Omana, and he won't tell anything before the day of Omana. So last day he told, I will be very hesitated to Omana treatment. Then we'll counsel him. Nothing will happen. We'll give you milk with some other kashayas. So will not face any difficulty. Automatically will get Omana. And still we given a double dose of Madanaphala. So usually very good Madana Pippali will give Antanaka Mushti Pramana is the dose of Madana Pippali. So 3 4 Madana Pippali powder. It may comes around some 2 to 3 grams of Madana Pippali powder. But in this patient we are given 7 to 8 grams of Madana Pippali. So we need to induce Vamana. What happened after giving Akantapana, full stomach milk and Vamana Aushada, the patient didn't vomit. We forced him to put the fingers over the throat also. We induced with catheters also. No vomiting. Such a stubborn patient. After half an hour, patient went to semi-coma. Vamana Aushadhi has been digested and it circulated everywhere. So he is having a blurred eyes and he is semi-coma. He went to semi-coma. Then what to do in this patient? Already Vamana Aushadhis get digested, but there is no Vamana. Then we should induce Virechana. For Deepana Pachana, again 4 4 Chitrakadivati, 4 4 Shankavati, along with Yarana Kashaya, we are given. We try to wake up the patient and make him to take these medicines. Then after 45 minutes, he will get loose motion. After having a first loose motion, his conscious get back up to 80%. Second, third loose motion, he will become normal. Okay, we started Omana by 6:30, finished by 11 o'clock. So this will happen when you induce Vamana into a most hesitated patients for Vamana, or else if the Vamana should get digested. So that we should finish Vamana within 45 minutes. One Muhurta Kala, Acharya told we need to wait one Muhurta Kala for first bout. But nowadays, what we will do, we will finish Vamana within 45 minutes to 1 hour. Everything should be finished within that time. After that, I need to counsel the patient before going to the Vamana. At least they must have some 10 to 15 times of Vamana in their lifetime. Otherwise, I won't take them to Vamana. So nothing will happen, but Madanaphala is stronger one. Don't play with Madanaphala. We know Madanaphala is a very strong drug. For that reason, many of my teachers won't take Madanaphala for Vamana. They will go without Madanaphala, only they will give Estimadu or Vachachurna, Akantapana only, they will finish whole process of Vamana. It's also possible. With them also we can, but Shuddhi will not be there. That projectile vomiting will not be there. So Vamana will be happening. That will do Vamana by giving water, by giving Akantapana and Vamanopaka Kashaya, Estimadu Fanta and all. But this is a very stubborn case. And his weight is 80 kgs. Very long, 6 feet height, 80 kgs. Very strong guy. Still I remember. Okay. So always we should share our bad experiences. I have done more than 3,000 Vamanas in all the cases. In my 12 years of clinical experience, 2 years, 3 years of PG, UG, everywhere. But this was very stubborn case. From 2003, I know Vamana. I conducted Vamana. 2022 now. Almost 19 years in the journey of Ayurveda. This is very stubborn case. Then I called my senior, my gurus. They assured nothing to worry. Things will be all right once I had a loose motion. So this is the experience. You must know if any difficulty after giving a Vamana. So just give Pachana Aushadhis and you will be all right. Always, while we are in UG, Vasantika Vamana, we used to keep all emergency drugs in Panchakarma theater. Even in my clinic also used to keep, but not required. Now we have mastered in Vamana. So during that time we need to keep atropine, adrenaline. So one is anti-emetic drug, antacid, IV fluid also. Everything will be get ready in Panchakarma room before doing Vamana. So that kit was made, emergency kit. So we have seen some Rakta Vamana also during Vamana. If they have any ulcers in the stomach, they will do blood vomiting. Okay. So these patients also we have seen severe burning after Vamana also seen. We have seen almost all complications of Vamana. Okay. This was very stubborn case. When patient goes to the semi-coma, at least if you admit the patient to the some other ICU or hospital, they won't do anything. We need to take out our Madanaphala. How to take out Madanaphala? We need to Pachana of the drug and at least we should show the direction. If there is no Urdhva Shodhana, at least we should do the Adho Shodhana. So that is the password you must remember always. So every disease has a treatment and every poison had an antidote. But we need to give it right time, right place. Okay. ಎಲ್ಲಿಗೆ ಬಂತಪ್ಪ ಇದು ವಮನ ಕೇಳಿದ್ದಕ್ಕೆ Ipecac syrup. In patient with recent ingestion or involving substance fully absorbed. There we have to give Ipecac syrup. Okay. Number of Patra Vishas according to Sushruta. Number of Patra Vishas according to Sushruta. Number of Patra Vishas according to Sushruta. 8, 5, 3, 12. Number of Patra Vishas according to Sushruta. 8, 5, 3, 12. Answer is 5. Patra Vishas, Mula Vishas, Pushpa Visha, Phala Visha, Allah, either like classification you should go through it. Answer is 5. Number of Nirvisha Sarpa according to Sushruta. Number of Nirvisha Sarpas according to Sushruta. 22, 12, 10, 8. Number of Nirvisha Sarpa according to Sushruta. 22, 12, 10, 8. 22, 12, 10, 8. How much Nirvisha Sarpa? Classification and is one of the important FAQ in Agatantra. It is 12. As per Sushruta, Parama Kriya in Jangama Visha Chikitsa is. As per Sushruta, Parama Kriya in Jangama Visha Chikitsa is. Jangama Vishದಲ್ಲಿ ಪರಮ ಕ್ರಿಯೆ ಏನ್ ಮಾಡ್ಬೇಕು ಅಂತ ಆಪ್ಷನ್ ಎ ರಕ್ತ ವಿಸ್ರಾವಣ, ಆಪ್ಷನ್ ಬಿ ಅಗದಪಾನ, ಆಪ್ಷನ್ ಸಿ ಮೃತ ಸಂಜೀವಿನಿ ಅಗದ, ಆಪ್ಷನ್ ಡಿ ಕಾಕಪಾದ ಜಂಗ ಚಿಕಿತ್ಸಾ. So what we have to plan in case of Jangama Visha Chikitsa, Parama Kriya in case of Jangama Visha Chikitsa. So already we told about in case of any poison animal, Jangama is animal, any poisonous bite, Rakta Visravana is the first thing. Okay, answer is Rakta Visravana. Next question. Murvadi Churna is told in Ashtanga Hridaya in the context of. Murvadi Churna is told in Ashtanga Hridaya in the context of Mushika Visha, Luta Visha, Dushi Visha, Gara Visha. Murvadi Churna is told in Ashtanga Hridaya in the context of Mushika Visha, Luta Visha, Dushi Visha, Gara Visha. Mushika Visha, Luta Visha, Dushi Visha, Gara Visha. Murvadi Churna, Gara Visha. Gara Visha na Dushi Visha na? Murvadi Churna. Dushi Visha. ಅಲ್ಲಪ್ಪ, ಮೂರುವಾದಿ ಚೂರು ನಂಗೆ ಪೆಂಡಿಂಗ್ ಇಟ್ಕೊಳ್ಳಿ. ಇಲ್ಲ, ಐ ಹ್ಯಾವ್ ಎ ಡೌಟ್. ಮೂರುವಾದಿ ಚೂರು ನಾ ಸ್ಟೋರಿ ಅಷ್ಟಂಗ ಹೋದ ಕಾಂಟೆಸ್ಟ್ ಆನ್ಸರ್ ಕಳಿಸ್ತೀನಿ ಆಮೇಲೆ ನಾನು. ಮೂಷಿಕ ವಿಷ ನಮ್ಮ ಮೂಷಿಕ ವಿಷ ಮೂಷಿಕ ವಿಷ ಬರ್ಕೊಳ್ಳಿ. ವಿಲ್ ಟೆಲ್ ವೆಲ್ ಡೂಯಿಂಗ್ ದ ಕ್ಲಾಸ್. ಮೂರುವಾದಿ ಚೂರ್ಣ. According to Sushruta, varieties of Shatapadi. According to Sushruta, varieties of Shatapadi. According to Sushruta, varieties of Shatapadi 8, 7, 6, 10. Varieties of Shatapadi 18 number. Shatapadi 8. Visha and Madhya have 9 properties in common except. Visha and Madhya have 9 properties in common except. Ojaguna is opposite to that of Visha. Ojaguna is opposite to that of Madhya. Okay, so Visha and Madhya have equal gunas except Sukshma, Vishada, Lagu, Anirdishya Rasa. Vishada, Sukshma, Lagu, Anirdishya Rasa. Anirdishya Rasa is the property given to Madhya, sorry, Visha. It's not present in Madhya. ಈ ಕ್ವಶನ್ ನೋಡಿ ಹೆಂಗಿದೆ. In Buddhist tradition, the practice of Agada Tantra is known as. In Buddhist tradition, the practice of Agada Tantra is known as. In Buddhist tradition, the practice of Agada Tantra is known as Sarpa Vidya, Garuda Vidya, Janguli Vidya, Damshtra Vidya. In Buddhist tradition, the practice of Agada Tantra is known as Sarpa Vidya, Garuda Vidya, Janguli Vidya, Dhamishta Vidya. Janguli Vidya, Buddhist tradition. Next question. Identify the paryaya of Visha. Identify the paryaya of Visha. Stavara, Jangama, Gada, Kshveda. Stavara, Jangama, Gada and Kshveda. Stavara, Jangama, Gada and Kshveda. Kshveda. The Kanda, poison. Kanda means tuber. The Kanda or tuber poison, which produces the loss of speech and weakness of the neck. Which produces the loss of speech and weakness of the neck is. The tuber poison which produces the loss of speech and weakness of the neck is. ಇದು ಆನ್ಸರ್ ಗೊತ್ತಿದ್ರೆ you should answer, otherwise skip. ಆನ್ಸರ್ ಎ ವತ್ಸನಾಮ, ಆನ್ಸರ್ ಬಿ ಪಾಲಕ, ಆನ್ಸರ್ ಸಿ ಕರ್ದಮಕ, ಆನ್ಸರ್ ಡಿ ವರಾಟಕ. ವತ್ಸನಾಮ, ಪಾಲಕ, ಕರ್ದಮಕ, ವರಾಟಕ. ಆನ್ಸರ್ ಇಸ್ ಪಾಲಕ. Which of the following is outside the preview of Transplantation of Human Organs Act? Which of the following is outside the preview of Transplantation of Human Organs Act? We have a law for organ transplantation. Okay, so without that we cannot move for any organ transplantation. In Karnataka, this organ transplantation law is very strict. Here we need to take a permission from the committee. The committee is headed by a district commissioner, district magistrate. Okay, so any organ transplantation. So organ transplantation donor must be their relative. It should not be any far relative or any other thing. It's a blood relative, and they have to scrutinize everything. Then only they will give the permission for organ transplantation in Karnataka. Andhra and Tamil Nadu, there is no restriction. That's why for kidney transplantation, liver transplantation, many people will move to Tamil Nadu, Andhra, Maharashtra. Their laws are not so strict like that of Karnataka. Okay. So here, which of the following is outside the preview? There is no scrutiny for this organ transplantation. So which is that they are asking? So first one is eyes. Eyes transplantation, we need a lot of law register requirements. And eardrums. Eardrums, so it's a minor surgery, but they will take consent from everywhere. And ear bones, it is also a surgery, ear transplantation, they will take consent from everywhere. And option D is bone marrow. So bone marrow transplantation will not come under any of these scrutinies. And for ear transplantation also they have to report. We did some transplantation, but bone marrow transplantation is a therapy in case of cancer. Okay, it's one of the optional therapy in case of cancer. Bone marrow transplantation. Okay, so when they will do bone marrow transplantation, in which stage? If all chemo, radio won't work, so surgery, chemo, radio. So bone marrow transplantation is the last option in case of cancer, if other treatments won't work. So it is indicated in some cancer types, not in all cancers. So lymphoma, Hodgkin's or non-Hodgkin's lymphoma, during that cases, some blood cancer patients. So what they will do in bone marrow transplantation? So for some chemo, it won't work with the minimum chemo drugs. So during bone marrow transplantation, they will give you strong chemo, strong anti-cancerous drugs. That drugs, along with the cancer cells, that will kill the bone marrow. That will do the damage to the bone marrow. So that they need to transplant a bone marrow after a strong chemo. Got it? Why the bone marrow transplantation? So they will give you strong chemotherapy. So along with the cancer cells, bone marrow will going to die. Most of the blood cells will going to die. So to rejuvenate it, they will take out all bone marrow from the body and transplant a new bone marrow. Success rate is very less, but still people will have this option. Costing will be around some 25 to 50 lakhs. Duration 3 months to 1 year. Recovery rate. It's not a simple thing, just like putting some IV injections or IV antibiotic. Hmm. But it is a treatment. It will comes under treatment, so it is not under the preview of any organ transplantation act. This is the clinical feature of which poison? Dahavat Agnireva Binat Tivra Vedanam Ashu Dahavat Agnireva Dahavat Agnireva Binat Tivra Vedanam Ashu. Okay. So this is the clinical feature of which poison? Scorpion, snake, spider, alarka. Scorpion, snake, spider, alarka visha. Dahavat Agnireva. So you know about poisoning of Rushika, Sarpa, Luta, Alarka is the option. Rushika, Sarpa, Luta and Alarka. Answer is Rushika. Pitta Pradara. Okay. Dahavat Agnireva. Binatam Tivra Vedanam Ashu. This is the poison of scorpion sting. So nowadays, for scorpion sting, they will give you injection over the area. It's called as blocking injection, anesthetic injections. Nerve blocking they will do to reduce the pain. That is the one thing. And next, they will give you cardio activators and cardioprotective drugs, prazopressexel like that. So or digoxin like drugs. So these drugs will going to increase cardiac rate because scorpion sting is a cardiac poison. Okay. In olden in folklore practice, they are using Nerium indicum mula for scorpion poison. So ಕಣಗ್ಲದ ಮೂಲ ಯೂಸ್ ಮಾಡ್ತಾ ಇದ್ರು ಗಂಟೆ ಗಿಡ ಕಣಗ್ಲದ್ದು ಬೇರ್ ತಗೊಂಡು ಅದರಲ್ಲಿ ಔಷಧಿ ಮಾಡಿ ಕೊಡ್ತಾರೆ ಸ್ಕಾರ್ಪಿಯನ್ ಪಾಯ್ಸನ್ಗೆ. somewhere we will heard about mantras also for scorpion sting. They will apply some ಶೀತ lepas over the area. ಸೊ ಅವಾಗ ಇಮಿಡಿಯೇಟ್ ಆಗಿ ಸಿಗ್ತಾ ಇದ್ದು ಮಡಕೆ ಮಣ್ಣು. ಸೊ ದೇ ವಿಲ್ ಮಡಕೆ ಎತ್ತನ್ನು ಮನೇಲಿ ಒಡೆದು ಅದನ್ನ ಮಣ್ಣು ಮಾಡಿ ಹಚ್ಚಿ ಬಿಡೋದು. ಸೊ ಶೀತ ಲೇಪ. ಓಕೆ. Next, as per Charaka Samhita, Sangna Stapana Karma is indicated in which of the following Vishavega? As per Charaka Samhita, Sangna Stapana Karma is indicated in which of the following Vishavega? Sixth Vega, fifth Vega, fourth Vega, third Vega. Sangna Stapana should be done in which of the Vishavega? Answer is sixth. Third, fourth, fifth in unconscious ಆಗಿರಲ್ಲ. In sixth Vega only the patient will get unconscious. There we have to do Sangna Stapana. Which dosha or dhatu gets vitiated first by poison consumption? Which dosha or which dhatu gets vitiated by poison consumption? Pitta, vata, rakta, mamsa. First dosha or dhatu will get vitiated is rakta. Which of the following is not used for the treatment of poisoning? Which of the following is not used for the treatment of poisoning? Which of the following is not used for the treatment of poisoning? Hrudayavarana, Avagahana, Nasya, Apakarshana. Which of the following is not used for the poisoning, for the treatment of poisoning? So Hrudayavarana we are using, Avagahana we are using, Nasya definitely we are using, Apakarshana. Apakarshana is the line of treatment in krimi. It's not the line of treatment in poison case. These are all some of the few questions in Agada Tantra. In all the questions, they are concentrating on Agadas, Agada Anupana, Visha Vega, Visha Vega Chikitsa, Visha classification, and Visha Lakshana. Okay. So IPC, CRPC questions somewhere missed. But ಇನ್ನೊಂದು ಮೂರ್ನಾಲ್ಕು ಕ್ವಶನ್ ಪೇಪರ್ ಇದೆ. ಸೊ ರೀಸೆಂಟ್ ಕ್ವಶನ್ ಪೇಪರ್ಸ್ ಅಲ್ಲಿ so they have one or two IPC, CRPC and modern questions. And poison, fatal dose, fatal period, poison lakshana, carbon monoxide, hydrogen cyanide, lakshana they ask. So we need to concentrate on these areas more. So when come to AAPGET preparation, whatever we told in the class is most important. Frequently asking question part and what we have discussed, the clinical ideas, clinical practice. Definitely these are most important. What you have not discussed is also important. Don't neglect anything, any point of syllabus into AAPGT exam. Everything in the syllabus is important. What we discuss in the class is most important. Only two things in AAPGT, one is most important and second one is important. There is no less important, not important. So this will not come in exam. You should not expect like that in AAPGT. So everything is important. What you discuss in the class, what we will highlight in the class is most important. Okay, this finishes previous year questions. So next class we'll continue with syllabus, actual syllabus. Okay. So already time is 6. To extend the time, we will get bored in a single day. Okay.